Healthier Together, sponsored by Regents Blue Cross Blue Shield of Oregon.
Falls are preventable. There's always something that we can do to help reduce the risk or reduce the risk of injury.
Dangerous falls among older adults are on the rise. At OHSU, it's one of the biggest causes of traumatic injuries coming into their care. And these falls can be life-changing, even deadly. Here's OHSU physician and geriatrician Dr. Katie Drago.
More people are aging well. That's wonderful. It means medicine has worked. But it means more people are living longer with chronic illness, with lots of medications, and sometimes falls can be the canary in the coal mine that a new medication has gone wrong, a new combination has gone wrong, or there's a new diagnosis or even an existing diagnosis that we need to worry about.
Ground level falls made up about 19% of all patients treated for trauma at OHSU in 2021, and the hospital has seen a sharp increase in these types of falls over the past 5 years. It's the #1 cause of accidental injury in older adults. That's everything from hip, shoulder, and spine fractures to blunt injury to the chest and even traumatic brain injury.
And a lot of these can be completely life-altering events where even if patients survive, their life may never be the same. The ability to live independently, the ability to do certain things, engage in certain hobbies, live in the community may be forever changed as the result of an injury.
We all have someone in our lives, a grandparent, parent, neighbor, or friend who may be at risk of falling. And there are things that we can do to help each other. First, be mindful of medications. Meds can combine in unanticipated ways. If you notice a change, talk to your doctor right away.
There are a lot of medicines out there that can do wonderful things for people, but have side effects like dizziness, like changes in blood pressure, like confusion or fatigue, even making walking a little more difficult. And oftentimes there are things we can do like adjust doses or change medications that may be a little more tolerable.
Next, exercise. Aerobic exercise, strength training, and working on balance.
Which we can always do in our 30s and 40s as well to improve our balance, can really pay benefits. Tai Chi, the practice, Chinese practice of Tai Chi, actually has some wonderful medical evidence to reduce not just the risk of falling, but also reduce the risk of injury from falling.
And finally, clear a path from reducing clutter around the house to adaptive equipment that makes getting around safer.
So being critical appraisers of our own environment can actually anticipate problems before they become problems. And then using experts at our disposal like occupational therapists, which really are the MacGyvers of medicine, to come into the home through services like home health, take a look around and see how can we make some minor adaptations so that way you can live better, live more independently, and live with a safer risk of falling.
It's all about taking charge of your health to continue to live independently.
Falls can be prevented. It's not an inevitability. It's not a normal part of aging. And there's lots of us in healthcare and in the community that are here to help reduce the risk of falling, keep you healthy, keep you independent, and keep you an active part of your life.
For more information and to see past stories to empower you to get proactive about your health, visit kgw.com/healthiertogether.